Okay, so today was a very long day. I'm exhausted. I just got home. It's 5:30. I left the house at 7 o'clock this morning to drive to the hospital that's should be an hour and 20 minutes away. It ended up being about 2 hours, 10 minutes away with the traffic. I had to deal with rush hour traffic this morning and it was raining, so I hit like three accidents on the way and traffic was just really crappy. So I made it there for my 9 o'clock appointment. Um, it was for a consultation with the surgeon, and I handed in all the stuff I collected, my previous TEE scan, my two ultrasound reports, my cardiac catheterization scan that I think they did just to rule out blockages, and they didn't find any blockages in the catheterization. So I brought those with me and my dental clearance, and they're like, "Oh, good, you got this, you got that, you did your homework, you got everything." And so the surgeon came in to talk to me, and we looked at the TEE scan together, and that's the first time I saw it because when they did it, I was asleep, so I didn't get to watch it like I do the ultrasounds. Um, so we watched the TEE with me, and he froze it on, where the jet, uh, with the regurgitation jet, which is the backflow of the blood. And he pointed out to me, I asked specifically, like, if you repair it, what are you repairing? What exactly are you fixing? What's going on? And he said that it's not a typical prolapse where you have a flappy valve. What's happening with mine, that this was news to me, was wherever I don't have my chart, my heart picture, but where the mitral valve is, whatever walls are on each side of the valve doors are connected to, um, that passageway is dilated. So my flaps, it's not that one's floppy and not closing, they're not reaching each other. And he said he knew this because of the direction of the jet. It was straight up, um, the regurgitation was just backflowing straight up in a huge jet. Um, so he wanted we scheduled surgery for Monday. It's going to be in 6 days on Monday, as long as my insurance gives them the approval, which they should. Um, the only thing with the insurance, it usually takes 2 weeks. It could take up to 2 weeks to get the approval, but they said they're going to call them and try to expedite it because I'm symptomatic. Um, because I just I just want to get it done. So the next thing the surgeon wanted to do, he answered any questions I had. And one of the things was he explained if they need to do a repair or if they need to do a replacement, um, what did I want to do? And he told me about the different valves. And of course, I already researched it. And I said, well, I was thinking the tissue valve because I don't want to have to deal with blood clots. And he's like, well, the tissue valves are good, but they might only last 7 years. And he said, the problem, he said the only reason he would recommend a tissue valve for my age, he'd recommend a mechanical. But he said some people just have issues and don't want to take blood thinners, don't want to pop pills every day for the rest of their life. And I'm like, oh, I don't care. I could take a pill every night. That's not what worries me. I'm worried about the risk of blood clots. And, I don't need to have a stroke because I had a blood clot or whatever. And he said, well, that's why you take the anticoagulant to to make it so you're not risking getting a blood clot. And he said, and this I also didn't know, he said there's a test, a similar at home test, similar to what they do if you have diabetes, where you prick your finger and you could test your blood and they can make sure that it's the proper whatever formula for not making blood clots. So once he said that, not that I want to prick my finger all the time, but once he said that, the idea of a mechanical valve and not having to redo surgery in 7 or 8 years over and over, because I'm only 45, and he said I was young, so I went ahead and I said, okay, so if you have to replace it, I'll do the mechanical. The other thing we talked about was going in through the ribs, and he said the problem with that is if they do the repair through the ribs, or they go in to do the repair through the ribs, and they see that it needs to be a replacement valve, or the repair isn't working. When they take me off the heart and lung machine, they try to get my heart going. If the repair is not doing its job and they need to replace it, he said, we're going to have to go through the sternum anyway. And he also convinced me that that's the better way to go, because he can get at anything he needs to get at and see everything he needs to see, and there's nothing in the way. And so he's been doing this for 45 years. So I told him, I trust your judgment. If you need to go through the sternum, whatever you need to do the best surgery that you can do and fix my heart. So he advised going through the sternum, so that's what I'm going to do. And that'll tack on about 2 weeks to my recovery time. But he said that there's no difference other than that 2 weeks. So once you get past that 2 weeks, it's going to be the same recovery as if they went through the ribs. So the first 2 weeks will be tough, but then it'll be the same recovery that everybody else has, I guess. Um, so then the next thing he wanted to do was send me, pardon me, send me to get another echogram because there were discrepancies. The TEE said moderate regurgitation, and one of the ultrasounds said moderate to severe. So the hospitals, the surgeon that I saw wanted the head cardiac echocardiogram department or whatever to do another echocardiogram and see what's going on and how bad it is. So this was where it got interesting. This should be a 20-minute echocardiogram, and I'm laying on the table, and this student, I think Jensen was his name. He was very young. He was like, I don't know, he looked like he was 25. Um, I was just like, he just looks so young, and so then I realized, oh, he's learning, because what he said to me is that he said he's going to start the echocardiogram, and then so and so, I don't remember, Olga or some name with a O, was going to come in and finish the ultrasound and make sure that the pictures were good and stuff. So he was doing the first half of the ultrasound, and then the girl came in to do, the regular employee came in. And when she was coming in, I said to him, I said, oh, are you learning? And he's like, yeah, I'm just starting out. And so they're letting me do some. And I don't know, he was observing the girl doing mine. And he was asking her questions like, how are you getting that picture? Are you going through the sternum? And she's like, no, I'm under her breast going in between ribs. And she said the mitral valve was right under a rib. So she was having a really hard time trying to see it. And so then she said, she's like, okay, hang tight. I'm going to go get the manager to come in and take some pictures. And we might get Dr. Chin to come in. And Dr. Chin is the technician and doctor that looked at my original records, and he's the one that wanted another echo. So then the manager comes in, and so I'm starting to get nervous. It's like, what are all these people? I understood the first one because he was a student, and then the normal girl, and now the manager, the department's coming in, and then she's gonna get this Dr. Chin guy to come in. Like, what is going on? I was worried, and she's like, no, 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 it's nothing to worry about. It might actually be good. So I'm thinking, what? And so Dr. Chin comes in and he's trying to get a picture. And the manager says, "Oh, these are the pictures I took," showing the Doppler with the color to show the blood flow. And so then this is my first realization of what's going on. Dr. Chin says, "What are your symptoms?" And I said, "Oh, I'm getting short of breath. And dizzy and just really out of breath, even like getting dressed or even just laying on my left side. I feel like I can't breathe." And then he says, "Well, might you have like lung issues? Are you a smoker?" And I'm thinking, is he about to tell me I don't have a valve issue? That would be great, but is that what's going on here? I said, "No, I've never smoked." I said, "My mom smoked when I was little." And he said, "Do you have a history of asthma in your family?" I said, "No." I said, "My sister had like exercise induced asthma. But my, um, my physician put me on an inhaler, um, for exercise induced asthma, but I don't have regular asthma." And so he's looking and he's like, I don't see regurgitation here." And I'm thinking, "What?" So then he has me, lay on my side, which all the other people had me do as well. And then, oh my God, this hurt so bad. He was like shoving this, it felt like a bone, this ultrasound wand into my rib cage. And I know I'm going to wake up with bruises all over my rib cage. And so then I guess he finally got it. He's telling me to breathe out and hold it. And then he's saying, "Capture, capture, capture," to the other technician to take the pictures. So I guess he was finally finding the regurgitation. And he's like, "Okay, yeah, you're having some severe regurgitation." So I'm thinking, well, that's interesting. So depending on who does your ultrasound, it could look like you're completely fine and there's no regurgitation, to someone getting a different angle and a better picture and seeing, yeah, you have severe regurgitation. So he said he could hear it. He could hear the regurgitation, but he couldn't see it. He wasn't seeing it on the ultrasound. Um, so that was just very interesting to me. Like, okay, good. I'm glad Dr. Chin came and that he found it. Otherwise, I would have been told, "You don't have regurgitation, go home," or something. Um, so before the ultrasound, they did all the pre-admission testing. So I had blood work done to make sure I wasn't pregnant, which I had my tubes cut and cauterized, tubal ligation years ago, 6 years ago. But they do the pregnancy test anyway, unless you're a boy, they do it no matter your age, no matter what. They did a chest x-ray. They did a nose swab, and I asked, "What are you looking for, pneumonia or something?" And she said, "No, they look for MRSA." And I said, "Oh, well, if I have MRSA, would they not do the surgery?" And she said, "Oh, no, if you have MRSA, they would treat the MRSA and then do the surgery because you can't do heart surgery if you have MRSA, I guess." Um, so hopefully I'm not I wonder if you're just a carrier or something. Because I think my mom's a carrier of MRSA, but she's not sick with it. Um, so that'll be interesting. My daughter had MRSA when she was 1. So I'm curious to see how that test comes out. Um, what else? They did a ton of blood work. Did I take a picture to see what they were looking at the blood for? I think I took a picture of the form. I had to sign a lot of forms today. Um, let's see, camera roll. No, I didn't take a picture of the blood work. Oh, but I did. I do have a picture of the Doppler of the jet. Let me see if that'll show up. Um, the camera's not really the camera's not really showing it good, but um, I'll try to put a screenshot up in the corner. But this is the valve, and all this Doppler, that white area right here, that's the regurgitation. So that's the severe regurgitation jet going backwards, and it's like showing really white on this. Um, but it's It's actually like yellow. It's like yellow and orange and red. So I'm gonna try to put a screenshot in the corner of this video. Um, and that wasn't from today's echo. That was from the TEE. So um, that's when the surgeon was showing me the jet and how it was going straight up from the valve. Um, and a question I have for the surgeon that I didn't ask is if that part of my heart's dilating and the valves are apart, if the valve gets fixed, what's going to keep it from dilating more or just dilating again? Um, so that's something I definitely want to ask. Um, my husband went with me to the consult, uh, and he's like, what is, if you have to have that mechanical valve, what's keeping it in place that it's not going to just fall down, And I don't know. I don't know what they do. So maybe I'll have to watch some YouTube videos, getting out of breath, YouTube videos of the valve. Oh, and they gave me, I watched other videos of surgery diaries, and people said they gave them some microbacterial soap or something to wash with. But with me, they gave me these wipes. I'm not even going to try to say that word. But I have to take a shower. It says I have to prepare my skin the night before surgery and the morning of the surgery at home using the package of cleansing wipes. Use one cloth to prepare each area of the body. This is interesting. Wipe using a back and forth motion, but do not scrub. Use all 6 cloths in the order as shown in the steps 1 through 6 below. So there's a picture of bodies. And so I take one cloth and wipe the one spot, and then the 2, and then the 3 and the 4, and then looks like my privates are last. I don't know. Oh, the second picture must be the second day. So this is everything's backwards here. This is the first day, and then this one I'm guessing is the second day. I don't know, I'll have to read the directions. Oh, and then down here, I had to check an initial that, yes, I wiped with the wipes. It's like, it's a verification label, and I have to sign and date this paper and bring it back with me. Um, it says I will need someone to help me with the skin prep. Don't apply any lotions, moisturizers, deodorant, powder, or makeup. Do not shave 2 days before surgery on any area of the body, including the legs and underarms. Men may shave their face. That's interesting. Um, I wonder why. Maybe because if you have a cut, it's an opening, but then why are guys allowed to shave their face? That's interesting. So that's the prep. And that's it. I don't have anything else to report. They said they'll call me as soon as they get the okay from my insurance that they're going to authorize the surgery. I'm thankful that the Dr. Chin did the echo and found the pictures of found an angle that he could get the regurgitation, because he verified that yes, it is severe. It's a severe regurgitation. So maybe knowing that the insurance will, it's not like, is it moderate? Is it mild? Is it severe? It's like they know because this guy said. And I know because I can't breathe. So that's it. I feel good that surgery is going to be Monday. I want to, between now and then, I'm not going to cry, but I want to write everybody letters and put them in envelopes for them to read. They won't even know I wrote them, but I'm going to tell my husband these are where the envelopes are for everyone, so everyone can just have this final letter from me. I'll probably just write about, I'm not gonna talk about what I'm gonna write about because then I'll cry. So, um, my big, 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 my biggest thing with this whole thing is knowing that my kids are gonna be okay, and knowing that my son is gonna be okay, and that he's gonna get along and survive without me here. So my letter to him will be encouragement for that, and just how to try to be the best person you can be in this world. Um, so that's all. I'll probably, if I get nervous, be doing another video maybe when I'm prepping for the surgery to say how that's going with these cloths. I don't know why I need someone to help me. Oh, I know what the other picture was, my backside. That's what the second picture was. So since I probably can't reach my own back, I'm gonna have to have a helper. Someone's gonna have to wash my back for me. All right, so that's all I got. Thanks for watching. If you have any questions for me, add them in the comments. My surgery will be Monday, November 21st, 2016, hopefully, if the insurance covers it or approves it. And you can subscribe to my YouTube channel for this so you get updates when I put new updates up. And if you want to go back, you can go back and watch my past videos to find out what I've been going through since I've been diagnosed. And I talk about Marfan syndrome that my son has, and I must have or most likely have. So that's in the previous videos as well. That's it. And my cat Blargensnarf wants to say hello and good night to everybody. So, hello and good night. Thanks for watching.